Place the animal in dorsal recumbency. A sandbag or towel placed underneath the neck assists in keeping the trachea near the skin surface. Routine surgical preparation of the surgical site is performed. A midline skin incision is made from the larynx to about the 8th tracheal cartilage. Continue the dissection through the platysma muscle. Blunt separation of the median raphe of the sternothyroideus muscle exposes the trachea. The small vessel that runs between these two muscles should be avoided and retracted to one side of the wound. The tracheostomy incision is made between the 4th and 5th tracheal rings. Placement further caudally to this results in a greater amount of soft tissue between the trachea and the skin, and this may result in dislodgement or occlusion of the tracheostomy tube. A suture of monofilament material is placed about the 4th and the 5th tracheal rings to permit manipulation of the tracheostomy site at a later time should the tube become dislodged. The extent of the incision into the trachea should not exceed 65% of the total circumference. The non-cuffed tube shown here is applicable for most instances. The trachea is cleared of blood, mucus and other debris before the tracheostomy tube is inserted. If the animal is anaesthetized and intubated, the endotracheal tube should be removed and the breathing circuit placed on the tracheostomy tube once it is inserted. The skin incision is loosely sutured and the tube secured about the neck with tapes. The next sequence shows the advantage of placing the sutures about the tracheal rings as described earlier. This allows the tube to be removed and replaced with considerably greater ease.